Oh, my name is Lurson Box, and I'm the Projects Executive Director at Zimbabwe Civil, Liberties and Drug Network. ZCLDN, we are into harm reduction, the prevention of HIV/AIDS amongst people who use and inject drugs, and we also advocate for drug policy reform. So what we would want to see with our Zimbabwe drug laws are laws that view people who use and inject drugs as people who really need public help in terms of coming up with treatment services for those people rather than sending them to jail.
Okay, what evidence do you have that decriminalization would be an effective approach in addressing drug abuse in Zimbabwe?
As we are aware that Zimbabwe actually belongs to the global village, we've also looked at other territories where drug decriminalization has been implemented. A very good example is the Portuguese experience, which has actually introduced drug decriminalization, and we have seen cases of drug misuse coming to a record level low, and also the spread of HIV/AIDS amongst people who use and injected drugs also dropping off. So Portugal is a very good example. Switzerland is also another good example where drug decriminalization has worked so well.
Okay, you mentioned that rehabilitation centers in Zimbabwe do not have the know-how on how to deal with drug users.
Yeah, that one is a correct assertion, because most parents who come to us, they actually tell us that after their children have been admitted to, certain rehabilitation centers, instead of the situation, improving, young men and women, they've actually gone back to drug use, and this time at a more serious level after having that treatment services upon them from the rehabilitation centers that we do have. Although I'm not saying that these rehabilitation centers are not doing a great work, they are trying their level best, but what is needed is more capacity building amongst those running those rehab centers, so that they become specialists in treating people who use and inject drugs.
Okay, any comment on drop-in centers?
Yes, a very good one indeed. Drop-in centers, they do work, because drop-in centers, they give a full bouquet of how a person who uses and injected drugs is supposed to be treated, provided that those running those drop-in centers have been trained and also have been funded to ensure that their services are actually utilized by the people who use and inject drugs.
Okay, in brief, can you define decriminalization?
Right, in brief, drug decriminalization is taking the issue of drug use as a public health issue rather than a criminal issue. We are saying take people who use and injected drugs to treatment centers and not to jails or to mental health hospitals.
Sir, may you please repeat what you're doing as an organization to help drug users?
Zimbabwe Civil, Liberties and Drug Network is actually a center of excellence where we have been doing some research, we've been doing some advocacy work that we are doing right now, and our major achievements to date is the writing of the Zimbabwe National Drug Master Plan, the treatment and rehabilitation guidelines, and also recently we actually released a new document which is actually, it's a policy brief in actual fact, on the impacts of crystal meth amongst the youth in our country. So that is the work that we are doing, and also trying our best to change perceptions on people who use and inject drugs. Some, they refer them as criminals, others, they refer them as people who are very violent, but from where we are coming from, a person who uses drugs has got human rights, and the right to health is the first right that person should be accorded.
Okay, what are some of the negative health effects of criminalization of drug users?
Right, some of the negative health effects, if you, for example, incarcerate a person who injected drugs, that person is 29 times more likely to get HIV/AIDS, and also, opportunistic infections like TB, HCV. There are some of the opportunistic infections that are actually, that affect people who inject drugs when they are in jail. And, lastly, a dignity of a person. what we need is to bring that person back to, to the doldrums of drug use, to a person who can actually contribute positively for the development of Zimbabwe.
May you please give us a comment on why people develop new ways, keep on developing new ways of intoxicating themselves?
Yeah, it is a result of police failure, and it makes people go to do a lot of experiments, with the new psychoactive substances because they are available. So if our policies can actually serve the intention that they were meant to in the beginning, we will not see people actually experimenting with new drugs. There is need for drug policy reform.
So what is your hope after having such a workshop with editors? What is the hope that you have as Zimbabwe Civil, Liberties and Drug Network?
The hope that we do have is that people who use the injected drugs who now, start being seen as, human beings, people who can be treated and go back to society. And also, we look forward that the journalists, they will also assist our country, especially in explaining what is drug decriminalization, because the perception out there is that drug decriminalization is legalization, which is not.
Thank you.
Thank you so much.